An economic time bomb is set to go off at the end of this year. When that happens, your monthly healthcare costs could more than double as premium prices go up and healthcare subsidies are reduced or expire entirely. But why is this happening and what can we do to stop it? Back in 2021, we passed the enhanced premium tax credits, which made your health plans more affordable when you bought them through the ACA marketplace. As of today, about 24 million Americans are enrolled in these ACA plans, and the majority of those people, about 92%, depend on the tax credit to afford their health care. Those tax credits had two really important consequences. First, low-income people who already qualified for subsidies got more tax credits and thus lower bills. Second, and this was really huge, middle-class earners, defined as those making at least $62,600 a year, finally got access to tax credits they didn't have before. And that helped lower their costs too. But there is a time bomb attached to all these savings. When these credits expire at the end of 2025, Americans, especially working class Americans, will pay substantially more for their monthly premiums. For example, a 27-year-old making $35,000 a year would see their costs go up by about 150%. And with the cost of everything else going up, those kind of increases are not affordable. So what's going to happen to your costs? Republicans want to let the tax credit expire, which they estimate will save the government about $30 billion per year. But that's nothing compared to the $170 billion that Trump's big beautiful bill sets aside for immigration enforcement over the next 4 years. All these commando dudes are arresting one guy, by the way. And Trump's expanded tax cuts for the rich are expected to cost the US economy $750 billion through 2034, which is why Democrats are pushing back, saying that the savings to fund these healthcare credits could be found elsewhere, and that the economic toll of unaffordable premiums will far outpace any short-term savings. Currently, there is no deal, which is why the government shut down this week. Now, the Trump administration insists that Democrats and only Democrats are to blame for this, but Republicans know that they are going to have a hard time getting reelected if these tax credits expire. So what do you think? Are we going to get a deal that protects Americans from rising healthcare costs, or are these credits going to expire? Let us know what you think is going to happen, and if you want to stay in the loop, you can follow for more.